Well, welcome, welcome, welcome again to the Healthcare Associated Infection Antimicrobial Resistance Program restart or first inaugural infection prevention office hours. I'm very happy to see everybody here and really looking forward to this being just a consistent space where we can check in with each other and see all your names. I can't see faces, and we'll talk about that a little bit later, but I do see lots of names, and I'm very encouraged by everybody that is here, and I really appreciate everybody's time. So we are starting twice a month office hours, and we'll go into some details around what that's going to look like for everybody. But what I want to make sure to say out loud, and I'll probably repeat myself, is that this really is meant to meet your needs. And so if there's anything about this setup or the forum in which I've kind of presenting today needs adjusting or tailoring, just feel free and don't hesitate to reach out to me and let me know how we can change this up to make it even better for you. So with that, we're going to start infection prevention office hours, and I will figure out how to advance my slides. Okay, and I definitely want to say another shout out to this is being sponsored, of course, by our program here at the State of Alaska in the Division of Public Health, but also in complete partnership and support by our Mountain Pacific Quality Improvement Organization partners. And there's a big thank you to Mary, who I've been chattering with back and forth because she's really the eyes and ears and the tech behind all of this. So very much appreciate her organizing this and setting up the invitation and then fixing the passcode that went out to you guys, which I'm glad you all got. And then Miranda Brzezinski, also with Mountain Pacific Health. She couldn't join us today, but huge help and support from her, and as well as Jolene. Jolene, how do you say it? Kageyama?
Kageyama.
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 Well, I'll let you introduce yourself and your role.
Well, good morning, everybody. As she said, Jolene Kageyama. I'm a licensed nursing home administrator. I'm based here in Honolulu, but I do support you folks in Alaska as your second account manager with Miranda. And so I look forward to working with you. I am going to be up there in your state at the end of March. So some of you I will be doing we are going to do some on-site visits to get to know one another, talk about some of your pain points and challenges that you have in your community and how Mountain Pacific might be able to assist and support you in those efforts. So I'm glad to be here. Thanks, Rebecca.
Yeah, thank you, Jolene. All right, next slide. Okay, so just to set the stage for why are we all here? Well, I started with the state public health department here in January, and it's taken me a little bit of time to just get my feet underneath me and figure out what it is I am doing. And this was something that seemed like a really great place to start, just to create some space for us to network with each other so we can start dialogue, continue networking, figuring out what it is that everybody needs and how the state and myself can really partner and support your efforts in all that you do every day as infection preventionists or those working within the infection prevention world. So IP office hours are going to be starting right now every second and third Thursday of each month. The second Thursdays are going to be these open office hours where it's a little bit less formal, and there is going to be a full hour allocated for this time frame, but if we get done in 25, 35, whatever it looks like, again, this time together is meant to be guided, hosted by me, but guided by you. So if we don't need to spend a ton of time together, then it may be shorter. If we end up having some really great conversation and good questions, Q&A, then it may take that full hour. But either way, the time will be on your calendar for this opportunity. And within these second Thursdays, I would like to facilitate you meeting the public health partners we have here. I don't know about you, but I've been a nurse in this state for over 20 years and an infection preventionist for over 9. And I've interacted with a lot of the public health people over the phone and via email, but there are actually people with faces behind all the work that they do here at public health. So I really want to spotlight them as much as they may not want it, spotlight them because they do such important work. And I think the more we know about who they are, what they do, we could just really strengthen the relationships that we know we already have. So we'll have a partner spotlight. And for right now, the first year, it's going to be the Division of Public Health and all the people that are around me here in my office. And then we'll have a little touch point of just where in Alaska have I been able to start doing ICARs? And we'll talk about ICARs, but that's your infection control assessment and response, which is a CDC module and platform for me being able to partner with you in your space to supplement and evaluate the work that you're doing in an effort to just really support. Find areas for improvement, really help prioritize and give you all a really solid base for the work that you're doing. And so those are going to be starting, and we'll talk a little bit about that. And then a little bit just to guide me, and all the chatter that comes out of me is just what's going on, what's the topic of the moment. And we've got a couple of topics that I'll bring up here. But if I'm missing something, let me know and raise your hand and speak up. Also, just as a standard of this time together is peer-to-peer support and networking. Who are we? Where are we? What are we doing? What do we need? And then we'll do that roundtable Q&A, because again, lots of cameras are off, so I don't know who you are or where you're at, but we'll do a roundtable and we'll just do a check-in so we can all know who's on the call. So the fourth Thursday of every month is going to be specific to a learning series. So this will be a featured topics by a subject matter expert, and it's going to focus on professional development, materials from Project First Line or micro learnings, and then just check-ins. So again, this is meant to be a much more formal. Both of the office hours will be recorded though, and we'll start to have a repository of those recordings for anybody that is a part of these registered meetings. But these ones, the second office hours of the month, should be more formal, and I'm gonna get CEUs attached to this as soon as I figure out how to do that. But in the meantime, we'll have some just good get-togethers around some topics, but we can look forward to hopefully some education opportunities for everybody on a consistent basis. So how to do this? So you've got a link here, and you guys will have access to this PowerPoint afterwards. But registering for this series is much like if any of you are already registered with the Mountain Pacific partners on their It's Worth a Shot. Once you register, this calendar series will populate on your Outlook, and it'll be there. That way you can chime in and pop in if you need to, but you can also ignore it if you want to, but it will be on your calendars twice a month, every month, starting here in March once you register. So I'm hoping that that will be a really easy way for us to continue to keep contact with each other. Any questions about infection prevention office hours, thoughts, or anything I didn't connect on? Some of us have faces, yes. Okay, great. And then it looks like Mary did put in the registration link, and it's right there. So anybody can take themselves off mute or raise their hand. I don't see any right now. Okay, you guys will learn not to be shy, because I'm not shy. So, all right. Next slide is talking about kind of how the office hours links to how you all got here in the first place. Hi, Kristen. Thank you for showing your face. So how you all got here. We've had an Alaska IP email distribution list for a very long time. I don't know, I did not know, so I don't know if you know, but Mountain Pacific sponsors and manages that email group. And so that's how we all got a hold of you. And so what we're going to do though is we're going to just put a little brand on that and actually start calling that email distribution or that group the Alaska Infection Prevention Network, or AKIPN, just because I couldn't come up with a better acronym. But that network, what that means is really, I think, under development, and really, again, hopefully a conversation that I will start with you here in the office hours and continue to develop over time, because network can mean a lot of things. It can mean connecting, talking, sharing resources, but it can mean so much more based on kind of the conversations we have here in office hours and what we all need within this network. I think a lot of us who are not new to the state have used this distribution list in the past just to reach out, either informally or, hey, do you have a policy on that? And I definitely think it should continue to be used like that. But I'd like to see us really enhance the network as much as we possibly can. So what we've got is the AKIP email distribution list that we're now referring to as the AKIPN. And what we're going to start doing is, as new members join that email distribution, they'll start getting an automated welcome message, which will just have some points of contact, and it also will eventually include the new IP welcome packet. So I know a lot of us received that welcome packet. I think I received mine from Kim Spinks back in the day. It's got the beaker, the little Muppet guy on it, and I didn't take him off. I did think about taking him off, but I didn't. I left him on there. But that packet's been updated, and hopefully we'll make that electronic so that literally if somebody joins the email distribution list, they will get an automatic message that welcomes them, gives them points of contact, and gives them that welcome packet. So that is hopefully going to be done by the end of this month. So I'm super excited about that. Also, what we're going to do is really try and keep good tabs on that email distribution list and who's on it, who needs to be on it and who needs to be off of it, and just keeping it more up to date. So what we're going to do is I will build into the office hours some kind of a polling or some kind of an opportunity for us during those meetings to just say, I've updated my contact list, or hey, I know about a new IP down in Queethlook. Whatever it is, we'll kind of have that regular touch point throughout the year, and at minimum, it's going to be quarterly. In the meantime, though, anybody can really reach out to Miranda or myself to get added to the email distribution list today. So just letting you know that that's going to be a cornerstone of these meetings, is to keep this email distribution up to date. Okay, any questions about that? Okay, and if anybody has a better acronym, let me know. All right. Okay. All right, next slide, I believe, is the lovely Carrie. So your first public health spotlight, partner spotlight, is Miss Carrie Edmondson, and I've got a little bit of information here on who she is and what she does here. But ultimately, I'm going to let her take the reins and just introduce herself to you all, and take it away, Carrie.
Hi, everybody. I believe I've probably talked to at least half of you at one point in time in the influenza season. My name is Carrie Edmondson. I've been here with a section of EPI for almost 7 years, and I mostly do the influenza surveillance. Oh, and I work really closely with Anna. She actually does all of the syndromic surveillance, ILI, all that data stuff. I mostly work with like the IPs like you and individuals out in the public that need assistance, as well as do all of the other reportable diseases for Alaska, being TB the next biggest thing. So yeah, if you all have any questions, my information I can put in the chat if you need to get a hold of me for anything. But thanks for having me as your first person, Rebecca.
And you have been here since 2017, right? That was on
Yeah.
your LinkedIn.
Yeah. So yeah, is
I
that yeah?
stalked you.
Yeah. So almost you did. Yeah, almost 7 years, right? It'll be 7 years in June.
Yeah, awesome.
Mm-hmm.
All right. Any questions for Carrie? Anybody who didn't know what she looked like? I didn't know what she looked like till I started here. All right. Well, I've got a couple links on here. The first one really is just the main page for influenza, which I'm sure, or actually really all respiratory pathogens. But I have no doubt we're all very intimately connected with this website, but it's a really great starting point to really access a lot of the work that Carrie and Anna do, and provide to us, making it, digestible and usable for the work that we do. And if anybody is not already receiving the weekly respiratory virus reports, I also put that link in there so it's easy for you to sign up and get that information. Any questions, or anybody want to come off mute and say, hi, Carrie, it's so nice to see your face. All right.
No, nobody. Oh.
No, poor. Mm-mm. All right. Well, I appreciate you being here, Carrie, and being my first.
Thank you.
All right. All right. So I don't know if anybody heard, but CDC updated their guidelines again. And I feel like, was March 1st a Friday? Yes, because that's what CDC likes to do, is put out updated guidelines on Fridays. So I have no doubt that everybody is familiar with the fact that these updated guidelines came out. So I just wanted to not ignore it, and I wanted to just provide the opportunity to talk through this a little bit. And so I've kind of summarized some talking points here. But in a nutshell, they came out on the 1st, and there's a link there to the actual media announcement, which of course within that has the, I think it's like a 15-16 page document really explaining what happened and what went into the decisions and why. Anna from Homer, hi.
Good morning. I have one, I put in the chat a plug for our APIC Midnight Sun chapter, of course. Get on another mailing list, everyone. But I also would ask a question of this group, because I think it's larger than our APIC Midnight Sun chapter, is I would love to, I don't know if we can do like a poll or like a monthly discussion, but I have probably bothered Charlie and Ayushi and other people enough throughout this pandemic, emailing them saying, the CDC changed their guidelines. What are you guys doing? And I'd love to figure out a way through this group or through our APIC group or somewhere to see like, what is every facility doing in response to these things? Because I think there's different, like, are you charging employees for testing? Are you requiring them to test? Is it optional? How many days are they staying home? We're all doing it differently. And some of us are larger corporations and some of us are independent hospitals or smaller clinics. But I would just love to have a repository or a list or a OneNote document somewhere of what every facility is doing, so that when my admin team says, hey, why haven't we changed in response to the CDC guidelines? I have more than just, well, it didn't apply to healthcare.
Right,
I
right,
can
right.
say
No,
Bartlett's doing this, CPH is doing that, Providence is doing that.
okay.
And I'm sorry to add to your project list because I don't want to do it, but if we
Mm.
could figure out a way, that'd be great.
No, do it. You know, my calendar's pretty empty right now, but no, I think that's a great idea because we've talked about this before, and I've talked about it with other IPs. It's like, okay, that yeah, the guidelines came out. Now what? And sometimes the talking points are helpful, and sometimes they're not. And I will say that these ones in particular, being for the healthcare side, I don't want to say not helpful because I'm not trying to disparage the guidelines or CDC, but it just didn't address it, right? And so to your point, although this is only affecting the community world, there are parts of the community world that do overlap with, you know, the healthcare systems, and I think it would help to really to talk through this. So
Yeah. And
so
I'll get our
yeah.
providers or I'll get our CEO to come to me and says, hey, look at this headline. And I say, yeah, it doesn't apply to hospitals. And then they'll say, what are other hospitals in Alaska doing?
Yeah. Okay. Great suggestion. I mean, like, I love it. I love the conversation. I don't have a real great response right now. So let's
Kelly has a great
really
answer in the chat, maybe, of
think
a
of,
SharePoint site, maybe.
okay. SharePoint.
I don't know.
Yeah, me neither.
All
I
I
love it
offer is
though.
problems and no solutions this morning.
That's okay. It's our first try, so we have to lower the expectations. The fact that we're all here, and I don't even know how many there are on this call, is a huge success because I was expecting 5 people that knew about this. So this is great. Okay, so I love the SharePoint site for sharing, and I don't know the answer to that either, but I will figure it out if that's something that we can do. And then, yes, that's literally the nature of what these office hours are intended to be about. So knowing that I don't really have a speaker slated for the presentation, you know, later in March, you know, maybe we allocate some time to do exactly what you're talking about. Just talk through this. What are you doing? And maybe it's identifying bullet points of what really are the sticking points. You mentioned a couple. You said, you know, those that are off work, you know, how are you returning to work, testing, that kind of thing. So, you know, maybe if there's some ideas around structuring that conversation, we can actually set up some polls and actually get some answers from anybody that participates as a starting point. So let me noodle on that, but that's a great call out. I appreciate it. All right. So in a nutshell, as we kind of already touched upon, this really, you know, according to CDC, only affects the schools, correctional facilities, shelters. What else is it? Many workplace settings, and, you know, the community at large. And so it does not apply to the healthcare setting. So whatever you're doing from an isolation standpoint, I think is what that really addresses. So you're not reducing the time frame in which you would have a patient in isolation, you know, in your facility, or, you know, what you would advise for patients being seen outpatient. You would have to really keep considering the full 10 days. But what the updated guidelines really gave us was if someone is sick with any common, you know, respiratory symptoms, they should stay home until the fever resolves for at least 24 hours and there's improvement in the symptoms. Well, the first question you have is, what if you don't have a fever, right? So it does offer up that recommendation for using additional caution, though, for the however long your symptoms occur and or you have a fever 24 hours after, and then adding 5 days to the end of that. And that typically will get you to that 8 to 10 day time frame that we have become accustomed to with COVID. And then the recommendations there being that if you do have higher risk, you are around higher risk people, maybe you're on an airplane with a ton of people and traveling on a plane for 6 hours, you might want to consider wearing a mask. You might want to consider testing before you go and see those high risk people, or seeing grandma at the nursing home, or whatever you're doing. So that in a nutshell is where the recommendations came from. So, and I want to give a huge credit to your local epidemiologist. I'm a huge fan. I fangirl over her all the time, but she just does a really great job of taking these complex things that come our way and breaking it down and talking through it. And it's really helpful then to process how I see the information, and then it really gives me talking points to help. So I use her a lot. Any questions about this first slide? Okay. And somebody will have to tell me if there's stuff in the chat too. So really what got laid out in the guidelines and the newsletter from your local epidemiologist is that updating the guidelines will not ultimately increase community transmission. And CDC did do a full review, which she featured and kind of talked through. So it was really helpful using actual data and some real case scenarios, the actual application in our communities to really say that yes, they're changing. Yes, it feels big, but ultimately at the end of the day, it will most likely not, increase community transmission, which for us, that's really what we care about. What's going to influx our hospitals and our clinics and our community at large. And then the good thing really is the additional cautions for the 5 days provided guidance for those at most risk, right? And it really does continue to keep that burden on those that are at most risk, the immunocompromised, the elderly, the unvaccinated per se. So it does shift that burden to those individuals, but it really does keep that focus on those individuals, which is the group that should be focused upon. But it also gives people who are maybe more risk averse doing their own individual risk assessments, the guidance that they would need to keep those extra days on if that's what they feel most comfortable with. And then the guidance is also symptoms focused, which is good because it can be applied to all respiratory viruses. And I think we need to, as a community, just start talking about these respiratory viruses as a group. And it does put some focus on RSV and flu, which in the past really hasn't gotten that much attention. So this really kind of brings those up to the same level of focus as COVID, and allows us to continue these conversations based on symptoms versus viral specific. And then at this point in time, COVID is now ranked 10th leading cause of death, so down from the 3rd leading cause at the height of the pandemic. And that's just how the data has continued to morph over time, and it's just something to keep into the back of your head. And then I liked this combination of graphs that she gave, just because I'm also visual. And so this really is another way to help quantify and explain this to community members or laymen or families and friends that may not be within healthcare and quite understand this. But it really does talk about that duration in which you are sick, you clearly have symptoms with or without fever, and that you need to stay home and away from others. That's just a given. Then you look at that 24-hour period, maybe after the fever resolves, and then you start your 5-day period of extra caution. Maybe you don't go to the concert that weekend unless you want to wear a mask or something. You make decisions about who you're going to visit. Maybe you put off a visit to grandma next weekend because that's 5 days after. So it does give a really great opportunity to just kind of see this visually. And it also gives the opportunity to have a conversation around whether or not a fever starts after symptoms. So really kind of extending that time frame. So I don't know if it was helpful to you, but it's always helpful to me to read the words and then see a visual to really explain where symptoms are going to be at their worst and peak and when you're going to be most infectious. And again, I think this visual helps people understand when they're not as familiar that happens before you're even symptomatic sometimes. And there's that period before, there's that peak period where you're definitely symptomatic. And then there's this kind of slow downgrade arch. So good visuals for me. I hope they are helpful to you. Any questions about this information? Anything we didn't cover in regards to the new, other than what Anna brought up and what we'll unpack a little bit later? All righty. Next slide.
Hey, Rebecca, are you going to be
Yeah.
sending these slides out
Yeah.
to all of us? Perfect.
Yeah.
That was a great visual.
Yeah. And then next topic, I did mention ICARS, but I wanted to give myself a plug. So infection control assessment and response, or ICARS consultations are available. Schedule one today. The link here is the CDC modules that are online. And the first ICAR that I'm going to be doing is scheduled in April 2nd. I'm very excited because it's somebody I've worked with in the past. So it will be very gentle on me for my first one. So I'm really looking forward to that. But the way to do that currently today is to just email me. I don't have a phone yet, and I don't have an automated way to request ICARs, but I'm working on both of those things. But in the meantime, you can email me. So schedule an ICAR today. Ooh, Mary, that would have been a good polling question. Did you know what an ICAR was before today? I'm going to write that down. Okay. Oh, and here's what they look like. So FYI, I did not know what an ICAR was before I started working here. I knew what a risk assessment was, but not necessarily the ICAR and the CDC and the modules and whatnot. So I've learned a lot. But CDC put together these modules and actually have been revising these over time. And there are now currently 11. So specifically, an ICAR is intended to be targeted, right, to a specific area, especially if it's being used proactively. So ICARs are usually synonymous with outbreaks, which is reactive. But the intention of this program really is to be doing these ICARs proactively in partnership with somebody like myself who can really help do a gap analysis, find areas of concern and high risk, help IPs, especially in smaller programs, prioritize. If you've got nothing else that you can work on these areas. And then it gives you a formal report that's confidential, and it really is in alignment with guidelines recommendations. So it's consistent with what's expected from an IP program. And it's really great because, again, if you've got target areas that you have interest in or learning curves in, and microbial stewardship, I'll say it out loud, like that's still a blind spot for me. So if I were a new IP, I'd want to maybe focus on antibiotic stewardship so that I could learn, so I could have somebody do that evaluation with me. And so I could have things in place and in front of me that I could show regulatory agencies who come in and say, what are you doing about antibiotic stewardship? And I would say, well, as a matter of fact, I had an ICAR done 4 months ago. So that's what this program is intended for. And there's a lot of really great materials that I'm looking forward to using on all of your behalf. Any questions about ICARs? Okay. I also am giving a plug. It's Patient Safety Awareness Week, March 10th through the 16th. So it goes through Saturday. I'm sure you're doing stuff at your hospitals or somebody's doing stuff at your hospitals, but I pulled together a summation of what came through from CDC. And I really liked I went through all of these and I really did go through why would I go to this link. So these use free training resources, it actually gives you materials from YouTube videos to actual graphics and memes to tweet something, to put something on Facebook, really have a social media presence around, patient safety awareness, which for us, there's always going to be something on hand hygiene. There's always going to be something on cleaning and disinfection. There's always going to be something on vaccines. Because that really falls underneath that umbrella of patient safety. So I thought that was cool. And then increasing your knowledge is going to be a plug for all the Project First Line micro learns. The funniest one for me is the diarrhea dilemma. I love the fact that they called it that. And they're really great. These materials are really great and they're fun and they're short. And so the challenge is to do one yourself and then go share one with a colleague. So the fourth one really is around printing materials, and again, watching videos, printing materials for patients, for families, friends, whatnot, but about being a safe patient. And that kind of helps start those conversations around, are you, up to date on your vaccines? How much do you know about proper hand hygiene, best practices, that kind of stuff. And then the Division of Healthcare Quality Promotion, didn't know who they were either. So I went there and looked them up, and they really are the cornerstone of a lot of why we do what we do, have these conversations, get the information sent to us that we do, the surveillance and the metrics that we monitor. This is the group behind the scenes that really kind of drives that ship. So plug for Patient Safety Awareness Week. All right, now I am done talking. So this is the roundtable Q&A portion. So hopefully everybody can see kind of some talking points, but feel free to share whatever you would like. But what I would hope for is, who are you? Where are you? How long have you worked in infection prevention? And what would you like to get out of the Alaska Infection Prevention Network and our regular IP office hours? And I'm going to start alphabetically or with Anna, just because I can see your beautiful face because your camera's on.
I knew it. My name is Anna Leewald. I work at South Peninsula Hospital down in Homer, and I am also the president of our Alaska APIC Midnight Sun chapter, which is why I plugged it earlier. And we would love to have anyone join. Dues are $20 a year plus membership, and we have a great time. And we are planning another annual meeting in the fall where we get everyone together.
But not November fall.
Probably October fall.
Okay.
We'll talk about that at our board meeting later today, Rebecca. How long have I worked in infection prevention? I got into IP. I have a background in public health, but I got into IP mid-pandemic, early pandemic in 2020. And what would I like to get out of this AKIP and regular IP office hours? I think kind of what I stated earlier, more roundtable, what's everybody doing? Maybe we could set bullet points for like COVID, for example, testing, treating, returning to work. Also just more resources. For example, this morning, we are building a daycare for staff children. And I met with our daycare administrator talking about IP stuff at a daycare, and I know nothing about it. And I know he has great resources and he's plugged in with Providence's daycare person, but I would love to have another group to just say, what do I need to know? How much jurisdiction do I have? What about conditional or reportable conditions and all that stuff? Because they're not really my patients or my employees, but it's very interesting to me, and this will challenge me over the weekend.
Oh yes, it brings back memories.
Yes, tiny children,
yep.
germs,
and their parents who work in your hospital.
Yeah,
fun.
Thank you for letting me know, Anna, that ANMC also has a daycare on campus. And then another thing, and maybe I've been talking to Anna Frick about this, but maybe it could also be something we talk about in this group. I would love to have a training of some kind on those reportable conditions, because my lab, says we send a lot of our samples to the state. If we get their positive reports from the state, do we also then have to turn around and tell the state that someone is positive? And the answer is kind of, that I've been told, is yes, because it comes from the state lab, but we want to tell state epi. But then just talking about who's really responsible and what's the best way to report, and just reminding people, doing a refresher on reportable conditions. That's another one of my big mystery bullet points this year. And Anna Frick said they are working on it, which is great. And now that I've taken up enough time, I will say that's it.
I love it. Thank you. I wrote down as fast as you talked. All right. Let's see. Jolene, I know you've already introduced yourself, but I don't want to ignore you either. You said who you are, where you are. How long have you been in this world? Mountain Pacific infection prevention?
I am not an infection preventionist, nor am I a nurse. I am a licensed nursing home administrator. I have an HR background and food science, human nutrition background. And so my job, I've been with Mountain Pacific for just over a year. And so my job is to help you find solutions to improve care in your community, in your hospitals or nursing homes. So, just any questions you have, shoot them our way, and we'll try to find solutions or answers for you.
Yeah, thank you. Well, the fun thing about infection prevention is you don't have to be an infection preventionist or a nurse to know about washing your hands and getting your vaccines and covering your cough. So, all right. Well, I appreciate you being here. Thank you.
Yeah, it's good to be
all
here.
right.
Thanks.
Miss Frick, Anna.
Hey guys, I'm Anna. I'm a lot of things at the State Health Department, including but not limited to the HAI epidemiologist and the syndromic surveillance epidemiologist. I'm at State Epi. I have been at State Epi for almost a decade. And I actually did my degree in hospital epidemiology, so I don't really know how to factor that into how long I've worked there, or I guess like probably realistically, we should only count my 9 and change years here with Epi. And I'm just here to hang out and do whatever you guys need, as I usually try to do. I'm just here for support. So whatever you guys need from me, I shall try to provide.
I love it. Just is another one of my favorite words. We're gonna have to nix it from vocabulary because Anna is nothing just, and we all know that. So I appreciate you being here, Anna, and your humility, but we all know the backstory. You are amazing and a great resource. We did Anna. How about Callie Perkins? Who's Callie? Looks like Mountain Pacific.
See if I can get my video to work. Sorry about that. Yes, as you mentioned, I work for Mountain Pacific. I am actually located in Wyoming. I cover a lot of the immunization work and care coordination, some of our patient safety and sepsis work. I am an RN by trade and have done infection prevention since early on in my nursing career. So just another resource for you guys, and
You
I'm
said
happy to be
just.
involved in the
We'll have a
call.
coin jar and then we'll have pizza afterwards. How many times somebody says just?
Thanks, Rebecca.
Yeah, thank you for being here. All right, next in line is we got Carrie, we've already heard from Carrie. Carrie, did you have anything else to add? Anything?
Nope, I am good.
Okay.
I have to head out, so thank you all for having me again, and I look forward to speaking with you all.
Thanks, Carrie. All right, Miss Gribben, Charlie. Uh-oh, there we go.
Okay, hey, now it works. I forgot about that little mic. So my name, Charlie Gribben. I am located in Juneau, Alaska, and I've been at Bartlett Regional Hospital since 2006. So that's almost 17 years. In that time, I've worked ER, CCU, house soup, and now infection prevention, and I've been in IP since 2017. Took over from Kim Vermidal and Jan Beauchamp. I don't know if those names ring a bell to any of you guys.
They do a little bit.
Yeah. So good community. Before Juneau, I lived and grew up in Anchorage. So I have a lot of connections around the state. What would I like to get out of IP hours? I echo everything Anna said down in Homer. Yeah, it's really nice to get support from you all, so we're just not alone figuring out what to do with all this new information. And just realizing you don't have to reinvent the wheel. Like, you can go look at things, but you can just use what already has been done. I find trying to recreate IT stuff and then videos, I love to do it, but it zaps your energy, and you need to get out from your computer and start looking at things more often.
Awesome.
Yeah,
Thank
I'm
you.
currently working on using the Project First Line EVS. So I just went down to my EVS staff because we've been noticing a lot of things not being cleaned. And there's been a lot of changes in our supply chain. And we went back to the really cheap microfiber towels versus ready to use wipes. So there's been a lot of confusion. And so I'm getting back out there and starting with EVS. And now I have to go into nursing and make sure they know what they're supposed to clean. So that's what my biggest effort is right now.
Mm-hmm.
Okay.
Everything all the time is the answer.
Yeah. Just do it.
Just do it. All right, awesome. Thank you, Charlie. All right, Jill Perkins said she needed to go, so she may be off, but if she's still on, she could go next. She might have left. How about Christine Couliard? Did I say it right? Looks like from Barrow. Christine, do you have mic? Hi, Debbie. Okay, well, Christine, if you can get off of mute, please, please, please join us and let us know who you are and where you're at. Clayton.
Hi, everyone. I'm Clayton Weingartner. I'm the HAI-AR program manager. I'm kind of more or less working behind the scenes, helping to support Rebecca's program and other HAI-AR program endeavors. Beyond that, if your facility was to encounter an MDRO, if you weren't to be hearing from Anna Frick, it'll probably be me, the one reaching out to you. What I'm hoping to get out of this, I want to get more engagement from the IP community. I don't really work in the infection prevention world, but I've been kind of dabbling and definitely trying to learn as much as I can about it. I've been in this role for about a year now. And I've definitely seen the need for more engagement, more connection amongst this community. So I'm really hoping this can be a place where people feel comfortable bringing their problems and also bringing solutions. So just like Rebecca, please reach out to me if you have any questions about how our HAI program can help support you and your facilities.
Thank you. Kristen McLean.
Hello.
Hello.
I'm going to try my hardest not to say just.
Don't do it.
Yes. I'm Kristen McLean with AHA. I'm their Director of Quality. I've been here since June. I can't believe it's been 9 months. But previous to that, I was with Providence and Seward, and I've done infection prevention for as long as I can remember, and I'm not going to admit how many years because I don't want to date myself. But I'm super excited that you started this these meetings. I think it's a need and very valuable, and I am here to support in any way that I can and any way that AHA can.
Awesome. Debbie. Also, AHA.
Call on me next. I've been at Alaska at AHA since 2012, so forever, but until like the last year, I really wasn't involved with the IP groups. And when before Kristen came on board, when Lynn left, I got to get involved and help with hosting and the logistics for the IP conferences. And I love working with this group. It's my favorite group to work with. So I just want to keep working with you guys. And if I come on some of those office hours or meetings, I'll just be there to listen in and learn, and hope to keep helping with the fall conferences that you guys have, and with travel support. We get a lot of funds from the FLEX program, which is the Medicare Hospital Rule flexibility program I call FLEX, and they have a lot of travel support with that. And so we can help IPs travel to Anchorage or to other places for meetings. So that's always reach out if you are wanting to do something and need some support, and we're here to help. Thanks. Thanks again.
Thank you. Emily Frost.
Hi, I am Emily Frost. I am with Providence Kodiak. We are a critical access hospital, and we also have long-term care as well here. So I manage both facilities. I've been here since 2021, and I think for my facility, at least, what would be most helpful is, the support engagements among everyone, and also how to get caregivers engaged with education, if it's hands-on flyers, send outs, whatever, maybe. I think that would be a big one for us, honestly.
All right, awesome. Good to see you. Emily Polensky or Polensk?
Yeah, you got it right. It's Polensky.
Okay, great. Welcome.
Yeah, no, I'm the IP for both of the Maple Springs facilities out in Palmer and Wasilla. And Wasilla is more geared towards rehabilitation, and Palmer is geared more towards long-term care. And I started this position, kind of like some of these other ones. I'm not a nurse. I'm a microbiologist, and started this right before the pandemic. Got my certification in November 2019. So it's been a wild ride, and it's been really exciting, and I've really enjoyed the IP world. And so I'm here to just learn as much as I can, because it's a whole new thing. I also am the HR director, and so it's a big double job for me. So
yeah,
as much as I can learn, I'm here to learn.
Yeah, well, welcome and thanks for sticking it out. And some of my favorite IPs are micro-based ones, non-nursing micro ones. So those are some of my favorites. You guys bring a lot to the table.
Thanks.
And you have a hot date with Jolene later this month, I think.
Indeed, yes.
Yeah. Okay, great. All right, who is next? Jamie. Is it Kuhn?
Close. Keen.
Oh, I would not have gotten that.
It's German. Just blame the grouchy people.
Okay.
I am with Mountain Pacific Quality Health, and my focus is on community health and bringing partners together with our homes, with our partners in the homes. And I am based out of Montana, actually. So I am a backup to Jolene and Miranda as they need help and getting whatever resources and training you guys are interested to you.
Okay. I missed meeting you in Montana when I was there.
I knew I've only been here for about a year, so I haven't gotten to do all the fun stuff yet.
Yeah. Well, hopefully in the future.
Yep.
Well, thank you for being here. How about Jen Anderson?
Hello.
Hi.
So, hi, I'm in Providence Seward, and I cover kind of like Emily Frost, critical access hospital. So I cover long-term care and the hospital side of things. I stepped into my role about 6 months ago for as a quality manager / IP. So it's been a big undertaking. I'm very new to the IP world. So I feel like a sponge right now, just taking everything in and gracious for any support. At this point, Kristen has been a huge support because I transitioned in her role that she previously had here. So, but I've been working for Providence Seward as a therapist, as an occupational therapist for the last 12 years. So I don't have a nursing background. I have a therapy background, but yeah.
That's okay. You still wash your hands a lot, and I have no doubt are immunized, so you're good.
A ton. But it's been good.
Well, good.
And it's
Well,
been
welcome.
good to have all the network and support.
Yes, and I feel like I owe you guys an email, but I am working with Amy Kilroy, and we will move forward and we'll get down there and support you guys with an ICAR soon.
Perfect. Thank you.
All right. Well,
Appreciate
thanks
it.
for being here. Yeah. Joanna, is it Claire? Cleary.
Clear.
Clear.
Yep. So Joanna Clear, I'm working here at Peace Health Ketchikan Medical Center. Been with Peace Health for 5 years and been an IP for 4.5. I only work in the ED for 6 months, then transition. I'm not a nurse as well. My background is in biology and public health with a focus in epidemiology, which is super helpful during COVID and other outbreaks, which I love to do. The other parts of IP is a struggle, but hey, it's a job.
Yeah, it can't all be sunshine and roses.
That's right. So with what I would like to get from this group is just really have like what Alaska is doing. As some of you probably know, Peace Health has 10 hospitals and we are the only one in Alaska. So a lot of our policies are Oregon and Washington based, and then we just Alaska just kind of put in there and like do what everybody else is doing. So just put what I would like to get what Alaska is doing and then put that in our policies and have a voice on those as well. I do have a long-term care as well and clinic, home health and another clinic in Prince of Wales. So it's been fun.
Yeah. Tell me again, did you say you were part of a health system?
Yeah, Peace Health is a part.
Peace Health. Yeah. Gotcha. Okay. All right. Awesome. Well, thank you for being here.
Thank you.
Rebecca, I have a quick question for Joanna. So at Peace Health, do you also have a long-term care facility or just hospital?
We do have a long-term care facility embedded in the hospital. So yeah, but then they are their own fun. Yeah, it makes it more fun because they are their own license, they are their own thing.
Very good.
But they're not.
But
they're
in the
not part
same
of our
building.
license. Yep. So weird.
Very good. Thank you for sharing.
We have
You're
a couple
welcome.
of places just like that, and you can find your group and commiserate. Oh, I can't remember because Castellano, but what was your first? Is it Catherine? Cordova. Are you able to join us? Come off mute. I feel like it's Catherine Castellano. Well, so I know she's in Cordova. I know she's new, so I'm glad to see her on the call. But if you can't come off mute, feel free to add into the chat who you are, how long you've been there. I do know they have a critical access hospital with a long-term care, and we've got a good kind of conversation going with that group. So welcome to Cordova. Kelly.
Good morning, guys.
Okay, look at the tank top. You know what? You and Jolene need to have some rules to follow.
I need to wear a sweater. I actually just turned on my fan because it's getting a little warm. Nice to see you guys. So I'm Kelly O'Leary. I have been an IP for 22 years. I started my career in Alaska and moved about 10 years ago. And I'm currently in Hawaii on the Big Island, and I work for Hawaii Department of Health. As an IP, I have been with them, I think, kind of like midsummer of 2020. I also have an independent consulting company, which Mountain Pacific has hired me to help out. So I am at your service. I can do presentations, I can do projects, I can, whatever you guys need, I am here at your service. We do something very similar, this group in Hawaii, so can share some ideas. And Project First Line is also something that I have experience with. We do ICARs too, so I feel like I could be at your service in however you would like. Let's see, did I answer all the questions? What would I like to get out of this group? Again, I'm here as a Mountain Pacific consultant to help. So I've been taking some notes on some ideas, construction. So if you're building a daycare, maybe we can talk about construction. Charlie, I'd be interested to know what Project First Line materials you're using with EVS. Is it the cleaning and disinfecting flyer or any of the education? And then certainly new IPs. I think that there's an opportunity to do some sort of mentorship program.
Yeah.
All right, nice to see everybody.
Okay, I like that
Yeah,
idea.
I found it's Project First Line and the California Department of Public Health put
That is a
together
really
a
good one,
four-part.
yes.
So I
Yeah.
found it on YouTube and downloaded the kind of instructor checklist and have been doing that. And each meeting's been about 30 minutes, and I do it once a week.
That is a
Repeat
really,
and
yep.
try to get to everybody. Yeah,
Oh,
it's
that's
been
really
helpful.
good.
Yeah.
Yeah, I totally lost my train of thought. Yeah, can't remember. Sorry. So
That sounds really good, Charlie. I wonder, I haven't seen that one yet, so you might get tapped for a future presentation. Okay, Larissa Skinner.
Hey everybody, sorry I'm unable to get on the camera. I'm actually en route, but I figure I'll pop in here really quick. I am also with Mountain Pacific and I'm not an IP. I am actually a social worker and not just a social worker, since that seems to be the word, right?
Yes.
I am a social worker with a long-term care setting background, and so kind of worked through the pandemic and then joined Mountain Pacific about a year and a half ago. And part of my focus, it's kind of a unique role in a way. I worked in long-term care as well as the community, so kind of in between worlds a little bit. And so my job is really to just kind of like what all the other folks from Mountain Pacific have said, really here to support you in education and resources and connecting. I feel like a lot of times we're kind of that bridge in connecting folks with different programs and resources that are already available, so we're not, duplicating efforts out there. So really here to support you, and also as far as what I look forward to from the group, I think Clayton mentioned that. I think it's just seeing this group grow and seeing kind of that, indirect mentorship happening that I think naturally kind of takes place in any efforts like this, and it's growing from each other and learning from each other. And I think I have a lot to learn from you all as well. So thank you for having me and looking forward to what's to come.
And Larissa, I may have missed it, but where are you? Where are you?
I probably should have mentioned that. I'm in the cold state of Wyoming. So
Southern
thanks for the
Wyoming.
folks who are, yeah, thanks for all the sleeveless shirts and enjoyment with turning the fan on and all. So
All right, thank you for joining us. Marcy, I think you're last, unless I missed anybody.
Hey, Rebecca. I'm
Hi.
Marcy Gallagher with another Mountain Pacific team member, and I am based in Montana. So like Larissa, although the sun is out here today, so should be thankful for that, but still cold enough to be wearing a nice warm coat, not a sleeveless shirt. But I have been with Mountain Pacific for a while, quite a while, and didn't really start working in infection control until probably the onset of COVID. So my background, I'm not a clinician. My background is in health information management and quality improvement. But when the onset of COVID, I guess, when CMS, as part of our contract, with them to provide free quality tools and assistance to nursing homes, infection control became a main part of our work. So one of the, I guess, if anything good came out of COVID, it was that we had to really learn to work with our departments of health and try and avoid duplication. You know, we have the state doing their outbreak investigations, and then we have Mountain Pacific providing tools and resources. So really trying to coordinate that effort, and was fortunate enough to meet both Rebecca and Clayton as they were down in Montana training with one of our IPs here in Montana doing the on-site ICARs. So that was really exciting to be able to meet face to face. And yeah, all our states, we cover the region of, as our staff probably mentioned, Montana, Wyoming, Alaska, Hawaii, and the Pacific Territories. And each state has something similar. So I'm really glad to see that Alaska is starting an IP office hours and kind of your formal presentation meeting that Rebecca's leading. And it's nice for us because sometimes what will come up on your call, we are able to share in our other states. So just really appreciate the opportunity to join and share with other infection preventionists and long-term care folks across the region. So nice job getting this off the ground.
Thanks, Marcy. I do see an A Steers or Stiers. Somebody I didn't call out. Oh no, I hear whispers.
Do you hear me?
Yes.
Am I louder? Okay.
Yes.
I am in Wrangell, Alaska.
Oh.
Yeah, a little southeast island. I am doing infection control for our long-term care here in Wrangell and in Sitka.
Okay, awesome. And what was your first name?
Angela.
Angela.
Yes, ma'am.
And how long have you been in IP?
I just passed my CDC yesterday. I took it and passed it, and I've been RN since 2013. So I transitioned over.
Awesome. Congratulations.
Thanks.
Well, welcome, welcome. All right. Well, I think, did I miss anybody else? Okay. Well, again, thank you everybody who was here. I have a lot of partners on this phone call who I probably might set up a meeting, Mountain Pacific, to really just debrief and kind of talk through maybe strategies you guys are using in other places to really set up the framework for the next couple of meetings, because we've had some really great dialogue and some really good ideas. And I am only going to be as good of a lead in this work with all of you collectively. So again, thank you so much for joining me today. And I will see you again, hopefully on the fourth Thursday of the month, which is going to be the 28th, same time, same channel, probably same password, and register for the series so it's on your calendar. Thanks, everybody.
Thank you.
Thank you, Rebecca.